Medical terminology, oncology, and laboratory terms. Oncology is the study of cancer, and some common lab terms you'll see. All right, let's talk about some oncology terms built from word parts. So these ones you can kind of break down the individual word parts to figure out the meaning if you don't remember them. On top here, carcinoma, carcino. This is referring to cancer. Oma is a tumor, so cancerous tumor, carcinoma. Liposarcoma, lipo is referring to fat. Sarcoma as a suffix is a malignant tumor. So liposarcoma is a malignant tumor of the fat. Metastasis, meta means beyond or after. Stasis is control. So beyond control, metastasis. This is referring to when you have a tumor or a growth that spreads to another organ, another part of the body. So it's beyond control. Like if you have a tumor in your lungs that is malignant and it spreads to your liver, now you have metastasis or a metastatic tumor. Plural for metastasis is metastases. Often you'll see it abbreviated as METS. Rhabdomyoma, rhabdo means striated, right? Myo is muscle, combining form for muscle. Oma is a tumor. So a tumor of the muscle that's striated muscular tumor. Sarcoma, sarco is connective tissue or flesh. Oma is tumor, so tumor of the connective tissue. This sarcoma can also be a suffix as a malignant tumor, right? Neoplasm, neo means new, plasm is growth. Plasm is a suffix, but the word root is embedded within that suffix in this term because it's made up of a prefix and a suffix. So neoplasm, new growth. Oncology terms not built from word parts. These terms can't be easily broken down into individual word parts to define the meanings. Some of them are still Latin or Greek terms that just can't be easily translated. And some of them are like English language words, common vernacular. So we'll go over this list here, this example. This is just a few. There's a lot more in your book, so I suggest making flashcards to kind of memorize these. The top one is benign. Benign is not malignant, non-recurrent, favorable for recovery. If you hear the term benign, this is good. Usually when you're talking about like cancer or benign growth, it means it's not spreading. Usually very easily treatable. It stays within its area of origin. Chemotherapy is the treatment of cancer with drugs. There are a lot of different chemotherapeutic agents, but when you're treating cancer with drugs, it's known as chemotherapy, often abbreviated as chemo. Malignant is tending to become progressively worse or to cause death when we're referring to cancer, malignancies. This is not a good term, not a favorable term when we're talking about cancer, tumors, growths. They often spread, they grow very large, they move to different parts of the body, and they will kill you unless you seek some treatment and get a cure, go into remission. Palliative care is caring for someone managing their signs and symptoms. So it's not necessarily the treatment of the disease, but the treatment of their signs and symptoms related to that disease. So at any stage of the disease, you can have cancer stage 1 or stage 4 and have palliative care like managing pain, nausea, vomiting, other signs and symptoms. Often mistaken for hospice care. Hospice care is a little bit different, but involves palliative care. Remission is the improvement or absence of signs and symptoms. If you go into remission, this is a good thing. So if you have a chronic disease like cancer or some autoimmune disease and you have an absence of signs and symptoms, they will say you're in remission. No detectable levels of cancer, you're in remission. They really don't like to use the word cure when we're talking about these chronic diseases because they can't return. So remission is a good thing. Hospice care is caring for someone at the end of life. Typically, they'll have a prognosis of 6 months to live or less. And hospice care, you manage this patient's signs and symptoms like through palliative care, pain management. You're easing their transition through their end of life cycle, caring for the patient and the family. Often done in different settings like in the hospital, outside of the hospital, long-term care facilities, or at home. hospice care. Diagnostic and laboratory terms built from word parts. So here's a few examples. Biopsy, bio means life, right? That's the word root, the combining form. Opsy is to view. So the view of life, a biopsy is specifically removing tissue to be viewed under a microscope. And they'll try to look for any disease processes, cancerous growths. So removal of living tissue, bio, life, opsy, view. Hematology, hemato, referring to the blood, right? Combining form for blood, hemato. Ology is the study of. So hematology, the study of blood. This often goes hand in hand with oncology. Hematology and oncology are usually grouped together. The study of cancer and the study of blood. So hematology, study of blood. Pathology, patho means disease, right? So the study of disease, pathology. Microbiology, micro means small. Bio, we said, is life. Logy, study of. So the study of small life. Typically, this is like a person who is looking under a microscope at bacteria, fungus, viruses, parasites. The study of small life, microorganisms, microbiologist. Diagnostic terms not built from word parts. Here are some examples. The first is chemistry panel. The chemistry panel is a blood test. They check for function of some of your internal organs like your kidneys, your liver, your lungs. Also check your blood electrolyte levels, your glucose levels, protein levels. There's a lot of things they can check on a chemistry panel. Very common test done. Complete blood count, often abbreviated CBC. This is also a blood test looking at levels of your white blood cells, your red blood cells, and your platelets. Very common test also. Culture and sensitivity. Culture is the first part of this test. Well, they'll take a sample from some body tissue, some excrement like sputum. They can do blood, urine, feces, and they put it in a petri dish and they grow it for typically 3 days and they see what grows. That's the culture aspect of culture and sensitivity. They can look at it, do certain tests on it under a microscope to see if it's a bacteria, fungus, virus, whatever grows. They have a pretty good indication if they do the culture part. Sensitivity, they sensitize it to different antibiotics. They'll introduce antibiotics into this petri dish and see which antibiotic is the best treatment for this pathogen, whatever is grown, what is the most sensitive. So looking for the correct antibiotic, the correct treatment. Genetic testing. Genetic testing is testing somebody's DNA. This can reveal certain aspects, mutations, characteristics that make somebody more susceptible to an illness, or they can also guide treatment. So genetic testing. Complementary terms built from word parts. When we're talking about complementary terms, these are terms that aren't necessarily the subject that we're studying this week or this chapter, but they're related to this subject. So they're complementary to this subject. These terms are built from word parts, so you can break these down. I'll go over this list of examples here. Cancerous, cancer, cancero, we're referring to something that has to do with cancer. OUS is pertaining to, so pertaining to cancer. Cyanosis, you guys remember cyano is a word root meaning bluish. Osis is abnormal condition. So the abnormal condition of being blue, cyanosis, somebody's blue. Typically we're talking about like their face, their lips, their fingers, cyanotic, cyanosis. Etiology, etio means the cause. Logy is the study. So the study of the cause, this is study of the cause of disease is what we're talking about. So an etiology is the study of the cause of a specific disease or outbreak. Iatrogenic. Iatro means caused by a doctor, caused by medicine. Genic is something new, something created. So this is something that's been caused by a doctor. Iatrogenic. Typically it's like a complication or something negative. Prognosis, pro means future. GNO, no. means knowledge. Osis is, the state of, so the state of knowing the future. Prognosis is what the doctor will predict is going to happen to you in the future. Oncologist, logist is a doctor who's studying, and onco is cancer. We're referring to cancer. So oncologist is a cancer doctor. Complementary terms not built from word parts. We'll go through some of these examples here. Afebrile. Febrile means fever. The prefix a means without. So afebrile is without a fever. So a normal body temperature, 98.6 degrees normal. Exacerbation. Exacerbation is an increase in signs and symptoms. So it's getting worse or it's flared up, exacerbated. Inflammation. Inflammation is a local response to an infection, an injury, characterized by redness, pain, swelling, inflammation. Morbidity. Morbidity is the state of being diseased or the incidence of disease within a population. So the morbidity rates, this is how many people are infected, or morbidity just means to be diseased. Virus or viruses, a minute organism smaller than bacteria, characterized by a lack of independent metabolism and the ability to replicate on their own. So they live within a host. A virus takes over a host's cell and uses that cell to infect and replicate and duplicate and spread. Infection. An infection is an invasion of a pathogen into the body tissues. So it can be bacterial, viral, or fungal. An acute infection is localized to a certain area, limited amount of time. Subacute is a little bit longer than acute, and then chronic is you're dealing with this for weeks or months or years or forever. An infection can be local or systemic. Systemic means it's traveled throughout the body, past some local infection. So you could maybe have an upper respiratory infection that's affecting your upper respiratory organs and tissues like your nose, your throat, your bronchioles. And this can become systemic if it goes into your bloodstream and causes a mass infection or something like sepsis. So singular and plural endings, the ending of your term might differ based on how the word is pronounced. If you're reading like some true Greek and Latin definitions, the ending might be different than the commonly used terms. Here are some examples: vertebra or vertebrae. Vertebrae is the plural, AE. Appendix, your appendix is singular. Plural is appendices. So if you're talking about multiple appendix. Fungus or fungi. Fungi is the plural. Larynx or larynges. Larynges is the plural term. In your book, you'll see there's the plural, the actual Greek terminology. The plural for carcinoma is carcinomata. ATA, mata would be the true plural definition, translation, but common English language medical terminology, someone would just say carcinomas. That carcinomata is really kind of a thing of the past. Medical terminology is full of abbreviations. There are a ton of abbreviations. Unfortunately, there are a lot of approved and unapproved abbreviations. If you're reading like a history and physical or a medical record, you might see some abbreviations that you've never heard of. And sometimes those abbreviations are not like approved standard language. They're just like been adopted over time. But your book has a nice list of a lot of abbreviations that are used. Here's an example of a few of them. BX. This is biopsy. If you see this in a medical record, doctor's history and physical talking about a BX, that's short for biopsy. RBCs, red blood cells. WBCs, white blood cells. DX is a diagnosis. That's one you see a lot. So look through these lists. You got to memorize them. A lot of them are pretty easy. Some of them are kind of obscure, but good luck.